Welcome to our weekly wellness segment with Trinity Health. We've got Dr. Derek Bergsma here with us. Today we're talking all about prostate cancer. So let's just start with the basics. Talk to us about prostate cancer. How common is it? And what we should be thinking about when we talk about prostate cancer.
Yeah, so thanks for having me here. Prostate cancer is the most common cancer in men. It can occur in about 1 in 8 to 1 in 9 men over their lifetime, typically associated with age. It's important to know about it because it isn't always apparent until it causes a problem. So it's important to be aware of detection methods or screening that you can find out about it earlier so that it can be managed appropriately.
Absolutely right. Early diagnosis is always key. So what are the guidelines for men as far as screening is concerned?
The age at which you should begin screening, it's important to discuss that with your physician, your primary care physician, but risk factors for prostate cancer, including age as you get older. You can have a higher risk of having prostate cancer, as well as a family history of prostate cancer, certain ethnicities, African American individuals, and certain genetic changes. But that would trigger testing, and typically about age 40 to 45 if you're at higher risk, or otherwise about 45 to 50. But again, any discussion about screening should be done after having a discussion with your primary care doctor. But if you are diagnosed with prostate cancer, it's important that your team, which is typically a urologist, the first physician that you would meet when you're found to have an elevated PSA or an abnormal rectal exam, would talk to you about next steps. Nowadays, an MRI could be an important part of evaluating the prostate further before a biopsy is done. A biopsy is essentially sampling parts of the prostate, either randomly or systematically through the prostate gland, or directed by an MRI if there's a suspicious area. And then that biopsy, the tissue that's obtained from there, would guide a next step in what to do. And if we try to basically identify cancer based on its risk, how likely is it to cause a problem? And we do risk stratification with lower risk men. Nowadays, actually recommended not to undergo active treatment, but to have their disease monitored closely. And again, older men that are nearing a normal life expectancy and or have other health issues may be advised to not be screened, or if they're diagnosed with a less aggressive cancer, to not undergo any treatment. But even younger men may be appropriate for monitoring the cancer, which typically involves checking the PSA at some period and or a repeat MRI or biopsy. But if treatment is recommended because the aggressiveness of the cancer would suggest a higher risk of causing problems or limiting someone's life expectancy, there are multiple treatment options.
Well, so let's go over some of those,
Yeah.
and what men should expect, right?
Yeah, so in addition, steps to guide the treatment decision could include additional imaging to look for any spread of the cancer. Nowadays, PET scans, specifically prostate-specific membrane antigen or PSMA PET scans, are increasingly used for men at higher risk of spread outside the prostate that you would want to know about before embarking on a treatment. But typical treatment options that would be ideally curative or completely eliminating the cancer for a localized prostate cancer could include removing it, a radical prostatectomy that's typically performed by a urologist, or radiation of some type.
Okay.
Which could include external beam radiation, where you come for a number of days to the radiation facility, lay down under a treatment machine that would deliver X-ray treatment, protons being another option, but typically X-rays, and that could be for a number of weeks, ranging from 4 to 8 or even 1 week.
All right, perfect. So now Trinity is part of the Cancer Network. Talk about the significance of that and what that means for a man who might be detected with prostate cancer.
Yes, so if you do have a diagnosis of prostate cancer and treatment is recommended, you would meet with a urologist who may offer a consultation with a radiation oncologist to discuss those different options. The Cancer Network provides increased access to specialists with increased expertise, greater support for clinical trial enrollment, which is an important part of understanding what the best treatment options are. And also just knowing that your team is working in a multidisciplinary setting and that your recommendation for treatment or discussion about options involves the expertise of a wide range of individuals that may offer complementary techniques.
Yeah.
And the treatment decision is often based on a discussion with the providers and the patient about, again, if their treatment, prostate cancer needs to be treated, but also about the different side effect profiles of surgery or radiation. Within the Cancer Network, specifically at Trinity Health, we do have access to the CyberKnife machine, which is a unique way of delivering external beam radiation that is highly precise and accurate and does allow us to shorten the treatment course for select men with prostate cancer to only 5 days, which men are often interested in dealing with their prostate cancer appropriately, but not having it drag out for 1 or 2 months, which classically has been the case. Wow. And we're able to do that because of the robot that has a miniaturized linear accelerator on it that can move with any motion that the prostate has, because the prostate can change position within the body during the course of treatment or between treatments. And the CyberKnife machine is able to lock on to little gold markers that are placed into the prostate. And at the same time, typically we would have a spacer gel that would protect the rectum, which is directly behind the prostate, from high-dose radiation. But with those techniques and using CyberKnife, we're able to be so accurate and precise that we can safely deliver treatment in a much more convenient schedule of only 5 days.
Wow. Well, I think the bottom line here is that maybe prostate cancer, men shouldn't be terribly concerned about it, especially with the treatment options here that are available, but so many times it really isn't even something that they need to treat.
Correct. It's important to have information to understand that there's time to figure out what the most appropriate way to treat your prostate cancer is. Knowledge is power. The right decision for one patient may not be the right decision for another patient, and that decision may be actively monitoring that treatment cancer instead of pursuing treatment. But if treatment is recommended, making a decision that you're comfortable with a side effect profile that fits your desires in life is important. And we're able to offer a full complement of options to men with prostate cancer, and we're excited to help men through that journey to make sure that they understand their options.
Well, that's wonderful. Dr. Bergsman, thank you so much for your time and for your expertise. We really appreciate it.
Thank you for having me.
You want to learn more? Just head to trinityhealthmichigan.org/oncology or give that number on your screen a call. That's 616-685-5600.